The true death toll from COVID-19 is revealed in the latest official figures from the Office for National Statistics. They've looked at the average number of people who would be expected to die for the time of year in England and Wales. And they added in the death registrations for 2020. In all, there have been more than 46,000 extra deaths between the start of the epidemic in March and the beginning of May. These excess deaths, as they're called, include not just those with COVID-19 recorded on their death certificate, but also deaths attributed to other causes. And the stats show there were 13,000 extra non-COVID-19 deaths over this period. Of these, the biggest increase over the long-term average was in deaths attributed to dementia, up 52%. It's likely that these were care home residents whose lives were cut short by the virus, even if that wasn't reflected on their death certificate. And there's also been a big increase in deaths from causes such as asthma and diabetes. In mid-April, they spiked at 197% and 161% above average. And they were outside hospital, so it's likely to reflect a reluctance to seek medical attention during the epidemic. But a second report by the ONS shows the epidemic is tailing off. 53,000 people in England had the virus in their latest household survey. That's halved, down from 133,000 last week. In fact, the ONS says there is a steady fall now. More than 0.4% of the population were infected at the end of April. By the end of May, it was just 0.1%. Although there are still 5,500 people a day catching the virus. The latest estimate of the R number is 0.7 to 0.9, below the key threshold of 1, indicating that the spread of the virus is slowing. But these stats predate the easing of the lockdown earlier this week. We'll see in the coming days whether more social contact has increased spread of the virus.